I'm Rachel Acuna. I'm the vaccine outreach nurse with Health Partnership Clinic, and I'm going to be talking today about the importance of adult lifespan vaccines and the importance of being up to date on all your vaccines. Adult vaccines are important to our existence within our community because as we age, the vaccines that we received as children have gradually worn off over time. So it's important to either get boosters or a new series of vaccines because they have developed newer and better vaccines as time has gone by. And vaccines are important because they actually help prevent the spread of disease in our community, helps us from experiencing more illness should we get that disease, which can cause us to miss work and create a financial burden on our families and within the workplace. Vaccines are absolutely safe for adults. Vaccines go through a very, very rigorous testing process. Once the vaccine's been developed, they are tested within a lab setting, and before they can even go into any kind of human and clinical trials, they have to be approved by the FDA and as well as recommended by the Centers for Disease Control as a vaccine appropriate for that specific disease. HPC, through a grant provided by the Kansas Department of Health and Environment, has initiated a no-cost vaccines program, which will be starting here in the month of July, and those include no-cost vaccines to current patients who can get them at their provider visits or call the clinic to make an appointment for just a nurse visit. And then for people who are new to the clinic, we would ask that you establish care with one of our providers in the clinic, and then you can get your vaccine either in that visit or schedule a separate appointment with one of the nurses. And we're also offering within our communities the no-cost vaccines to people experiencing homelessness. The standard recommendations for adults would be the pneumonia vaccine, also known as pneumococcal vaccine, and that would specifically target those people who are 65 years and older, but there are other conditions that someone might experience with their health that would qualify them for the pneumonia vaccine. We also recommend an annual flu vaccine. The COVID vaccine is also part of the ongoing adult vaccination recommendation. And then there's also shingles, which would be for 50-year-old and older, as well as HPV, MMR. Sometimes we either did not receive those as children, or that one has worn off and we would need a booster. And then also the CDC just recently made recommendations within 2022 for all adults aged 19 to 59 to be vaccinated against hepatitis B. Well, the benefits of any vaccine is typically prevention. No vaccine is 100% effective, but it does do a pretty good job of preventing disease. They definitely help prevent the spread of disease, and as well as symptoms should you get that specific illness. And then there are some specifics within like the shingles vaccine. Shingles outbreaks are very, very painful, and some people even experience, once that episode is over, will experience lifelong pain, nerve pain. So anything that can help prevent that would definitely be a positive, I believe, for anybody. As a federally qualified health center, Health Partnership Clinic really values and encourages our patients to with prevention of health care concerns. So the vaccine initiative is definitely a huge part of doing so, but we also offer primary care. So if you're overdue for your annual exam, we encourage our existing patients to call and schedule that appointment. Or if you have not been seen here at Health Partnership Clinic, we would love for you to schedule an appointment to be seen by one of our providers. And you would do so by calling 913-648-2266.